everyone, it's Amanda Sturgeon, and this is my pediatric PowerPoint assessment of school-age children. Table of contents: review screening, health promotion, physical examination, anticipatory guidance, and safety considerations. Things to note about school-age children. Children ages 6 to 12 are more able and usually willing to actively participate in health assessments than earlier age groups. Consider that school-age children will have new influences from peers, teachers, and that older school-age children might prefer privacy to discuss puberty concerns, and we should provide for modesty. Some of the screenings: do vital signs, check hematocrit, hemoglobin, vision, hearing, dental, motor skills, cognitive development, and growth and development. Vital signs in this age group are closer to adult values. Heart rate is going down because their heart is bigger, pumping more blood. Breaths go down as their lung capacity increases, and blood pressure increases. We want to check their hemoglobin and hematocrit every 2 years and screen for lead poisoning for those in urban areas, have a history of pica, check a lead level. Dental exams, mindful that they might lose 4 baby teeth a year until they're age 12. Check for caries, halitosis from bad teeth. Vision should reach 20/20 by age 8, and note that vision and hearing screenings are also performed in schools. Motor skills, gross motor skills, age 6, children can hop, skip, roller skate, and catch a ball. By age 10, hand-eye coordination is improved enough to play games like softball. Fine motor skills, age 6, they can print. Age 8, they can use script, able to dress themselves, draw a circle touching a square, and draw a person with 12 parts. Cognitive development. According to Piaget, they're in the pre-operational thinking to concrete operations stage, so their thinking is more organized and rational. They can see viewpoints of others. New skills enables them to add, subtract, write, spell, read. Erikson stage is ego development of industry versus inferiority. And they have increased attention spans, see cause and effect, and can categorize based on size and other characteristics. Health maintenance and promotion. Height and weight should be plotted on the growth chart, watching for unequal changes, noting children above the 85th or below the 5th percentile. Calculate their BMI. We want to discuss nutrition early and often. And immunizations should be reviewed. All childhood immunizations should be complete, except for the new immunizations and the booster required for 7th grade. Some physical examination specifics for school-age children. We want to inspect hair for nits, lice, and alopecia. Could be due to tight braids, ringworm, or systemic illness. Lymph nodes in school-age children. Small, non-tender mobile nodes are commonly found in the neck. Thyroid is not always palpable in this age group. If we note pale or boggy turbinates, it could indicate allergies. A horizontal crease across the nose is a sign of allergies in this group from frequent wiping up the nose, like that. We want to look for loose teeth and watch for permanent teeth erupting. A strawberry tongue could indicate a streptococcal infection. Tonsils could be enlarged, have exudates. We want to see if the adenoids are visible. Common ailments in this group. Integumentary. Watch for signs of anemia. Bruises and scrapes are common in this group. Examine children for lesions, bites from scabies, bedbugs, and ringworm. Watch for rashes and infectious conditions including scarlet fever, measles, impetigo, molluscum contagiosum, MRSA, fifth disease, and watch for Lyme disease. Respiratory, by age 7, children should no longer use abdominal muscles to breathe. We can assess for respiratory distress, noting retractions, accessory muscle use. And if we note breast tissue in males, it could indicate gynecomastia or precocious puberty in females. An abdominal exam, aside from the usual exam, a way to assess for peritoneal irritation is by pressing firmly with the diaphragm of the stethoscope and watching for grimacing or signs of pain. Liver spans 8 to 12 centimeters in the midclavicular line. Tip of the spleen is 1 to 2 centimeters below the left costal margin. And if we palpate a sausage-shaped mass in the left lower quadrant, it could be stool and be a sign of constipation, which is also common. Cardiovascular. Children over 7, the PMI is felt in the 5th intercostal space to the right of the midclavicular line. Sinus arrhythmia is a normal finding in this age group. Organic murmurs before age 3 could be related to congenital heart disease, and after age 3 could be related to rheumatic heart disease. Musculoskeletal. We want to observe the child walking for gait problems, coordination issues, foot, knee, or hip problems. Watch for leg calf-Perth's disease, which is necrosis of the femoral head, which would give them pain probably in one leg, usually with no systemic symptoms like fever. It's important to check for scoliosis or lateral curvature of the spine. Tends to begin as they enter puberty, and early identification is important for treatment. Watch for genu valgum or genu varum, knock knees, and bow-legged. My son had severe knock knees, and he had an epiphysiodesis, or surgery on his epiphyses or his growth plate, and a plate was put in and only allowed one side of his growth plate to grow, and it straightened out his legs. It was pretty amazing. We want to watch for growing pains, which can be common in knees, shins, thighs, worse at night, of course, after a lot of activity in the day. Genitourinary. We want to assess their Tanner stage of sexual maturity. Watch for signs of infection, abuse, sexual activity, including odor, discharge, redness, swelling, blisters, warts, lesions. Inquire if they have any problems urinating or any pain with urination. Discuss hygiene if it's an uncircumcised male. Check to see if his testes are descended. There's no unilateral swelling, redness, hernias. If they're complaining of anal itching, it could be pinworms. And neurological. We want to assess mental status, speech, behavior. Level of consciousness can be assessed with the pediatric Glasgow Coma Scale. Sensory and motor function should be checked, and we should check range of motion in all joints for flaccidity or spasticity. Anticipatory guidance for this age group should include discussions about menarche, puberty, sex education, alcohol, tobacco, and drug use. Safety concerns for this group, of course, is safety with sports, so safety equipment, helmets, knee pads, elbow pads, water safety. You want to discuss sun protection, use of sunscreen, clothing, car safety, make sure they're using their seat belts, and firearms. Are the firearms locked up? And what they should do if they encounter a gun at school or at a friend's. And these are my references. Thanks so much.